So these are the N95 masks that they recommend for hygienists and dental assistants to wear if you're using a high speed or anything in the office like a Cavitron to clean the teeth that creates a lot of spray or aerosol. And so a lot of dental offices right now are using S3 masks with a full face shield. And so when you get an N95 mask, they're not disposable. So this is what they look like. They come packaged in typically 20 to a pack. They're very expensive. And when you put this on, you actually mold it with both hands, and you start from your nose and kind of push in towards your face all around. And then once you're done molding this to your face and adjusting the straps, these don't go around your ears. There's two separate straps. One goes to the top of your head, the other one kind of goes back towards around your neck. Once you're done with it, you sterilize it. And this particular sterilizer is used with a UV light and an ozone atmosphere. So you hit the button, you place the mask, making sure it's fully open. You don't just throw it in there collapsed. It has to be able to get light all around it. So you face it upwards, and then you hit that button, and it goes for about 5 minutes. And then once it goes off, you take it out and you put it in, what they're using is like a clear plastic shoebox. And so each person has their own, and that way in the morning you just come and put it back on. And so that is how they're sterilizing the mask. It came with the manual, and it's very simple. We literally just plugged it in and followed the steps, and then you just put it in there. The biggest thing is not having any part of the mask fold over. You gotta make sure it's just open like a flower in full bloom. Your safety instructions, making sure it's not around any water when you plug it in. Making sure that you have the upper and lower shelves and the masks aren't touching each other. You gotta have to keep them separate so that the UV light can go all the way around it. And then this is the smoke test where you have the bulb and then the end where this fits in, and what it does is you'll be irritated by the smoke if there are any leaks in your mask. And so that's how they test it to make sure that it's fitted properly. And these are the different parts of it. And then the detailed instructions for that. And then we went through the OASIS training and the new SignIn procedure. So when we have patients come in, the first thing we do is they will text the office, "I'm here," instead of like they used to do, just walk in an office, sign in, or tell the scheduling coordinator, "Hi, I'm here." So now what they do is they actually text the office and say, "I'm here," using the Rhino app for dental offices. And once they text you that they're there, you send them a questionnaire. And the questionnaire will ask them, do you have a fever? Do you have a cough? Have you been around anybody with coronavirus? So once you go through these series of questions, you want to make sure that in the chart you are putting in there that you have taken their temperature, what the temperature was, and what they answered for the questionnaire if any of the answers were yes. If they are yes, you're sending them home. They're not going to be seen that day. And so making sure that you document this is very important. So the type of practice that we got was, this is the patient's overview, kind of like their history. This visit, you click on there, you type in what's going on in their visit, and then you type in next visit what you're gonna do. Once you're done with that, you simply post it. And then the scheduling coordinator can see what that patient's gonna be scheduled for next. Then you'll go and hit the flow, and once that clicks up, it'll come up with a screen where you release the patient so that you can track when they got there, when they left, and how long that appointment is taking. And that's good information, good data for you to kind of go and see. With this particular assistant, she's taking, an hour to do a cleaning. With the other assistant, she's taking an hour and a half. And so you want to track those things to see what's going on in that particular procedure to try to get things moving smoother, okay?